So good morning and welcome to the first session of the Northern Cancer Alliance Learning Week. As I say, this is a historic day for all of us, isn't it? I don't know whether you all felt quite emotional this morning watching the first vaccine being given and the second one being given to William Shakespeare, a wonderfully English name. I'd just like to take a quick moment to acknowledge the fact that people have signed up for these events this week and have taken some time out of their diary, because there is an absolute acknowledgement of the hard work and the pressure that everybody are feeling at the moment. So for people to take some time to attend these events, we are absolutely grateful for the precious time that you've given to us this week. So with no further ado, I would like to introduce our speaker for this morning, Karen Verrill, who is the centre head for the wonderful Maggie Centre in Newcastle. She's going to provide us some precious and valuable insight into the experience of patients, our cancer patients, during the pandemic. Thank you very much and welcome, Karen.
Thank you very much, and thank you for the invitation to speak. And as you say, on this momentous day, although we didn't know today was going to be the day, but it kind of fits perfectly with my presentation. So my presentation, which was done obviously before today, is Cancer Doesn't Stop Because of Coronavirus. And I just want to talk about the experiences I've had during these last few months. And I know everyone who's listening will have had different experiences to, what used to be normal. But this is just, what's happened in my experience. So next slide, please.
Ready.
So as I work for Maggie's, and I just wanted to, next slide, talk very quickly about what we do in case anybody listening isn't aware of the centre. And we are a unique model of support. We're designed by world-class architects, each centre. Each building is different to another Maggie's. We're always very close to the cancer centre, and it's a welcome and homely environment, non-clinical, no signs, no uniforms, no charge, no clocks. There didn't used to be hand gels or paper towels. We always had fluffy towels and everything was nice, but unfortunately we've now got signs on the walls about coronavirus and paper towels, hand gels, etc., like everyone else, but it doesn't seem to be detracting from what we do anyway. We have a specialist team of professionals. The centre head is usually a specialist nurse. We have cancer support specialists who are also oncology nurses, clinical psychologists, benefits advisor, and we have a team of fundraisers who help us raise funds to keep the centre going, although like all the charities, we have struggled this year because we haven't been able to fundraise. We'll have a programme of care for people who've had a cancer diagnosis and their family and friends, and there's a drop-in service, and you don't need to be referred to Maggie's. And there didn't used to be any need to make an appointment, but now we're taking a lot of people in by appointment. This is, you probably can't see this very well, but it's just a typical Maggie's Newcastle timetable pre-lockdown, because everything's had to change. Pre-lockdown, we got around 22,000 visits a year from people affected by cancer, and there was support, advice, information on cancer, treatment, side effects, emotional aspects of cancer, family issues with the nurses, booked one-to-ones and family sessions with the psychologist, benefits advisor to guide people through the benefits and grants available. And then we had lots of support groups, courses, mindfulness, living with cancer. And although I support people with all types of cancer in Maggie's, about 38% of the people accessing our service have been affected by breast cancer. So a fair amount of the people we see have had or got breast cancer. And as a result, there was a joint working programme piloted for patients with secondary breast cancer in collaboration with NCCC and Maggie's. And it was after an unmet need was identified for support for the women with secondary breast cancer. The project covered 2 years, was evaluated well, and is now an established service. And it meant I became a key worker in this project and was the first point of contact for many people with secondary breast cancer. I would spend time in clinics and see the patients as newly diagnosed with metastatic breast cancer, take them directly across to Maggie's after that, and they would have access to the full programme of care. Now, I've actually moved on, Joe and Sue, without realising. So next slide, please. So this project evaluated and has now become an established service, and it was because patients who were being diagnosed with secondary breast cancer and didn't have a specific key worker at that time in NCCC, were sort of didn't have someone to give them the support at the diagnosis. And when consultants would say, why don't you go across to Maggie's, having just been diagnosed with incurable cancer, it's a big step to take. So it didn't always happen. So now that I'm able to be present, and this is now, you know, established, permanent, and I have an honorary contract, it makes it much easier for people to access everything that we've got. Next slide, please. So this was the service for these patients pre-COVID. So different to now. So there was the formal link, as I've said. The patients would come over having been diagnosed and have access to the general programme of care and support, immediate access to secondary breast cancer support. I ran a monthly support group for these ladies, as well as a young women's support group for the under 45. And that was very, very well attended and would be facilitated by me. I also did couples evenings, so the patients could come across when they were, you know, first introduced to Maggie, and then would sometimes meet other people in the centre at the same time who were in a similar situation. There would also be husbands around, and then to make it sort of more social, I sometimes did evening events, and they could come along. The men could meet other men in a similar situation whose wives have got secondary breast cancer, and the women would mingle as well. And also living with secondary breast cancer courses, and then of course the other stuff that Maggie has. And pre-COVID, there was set up by the patients a small WhatsApp group so that they could notify each other or be notified of support group changes or updates for group members. Next slide, please. And the WhatsApp meant for anything that they needed to know about, like if a group was going to be on a different day, they could be notified. They also wanted to know when people had passed away. So it was a very small group led by them. And it became, once COVID sort of took over, it became very, very important to these people to continue with this WhatsApp group. And it actually grew in size. And what was coming through the WhatsApp group is some of the stories that I'm going to tell. It wouldn't be fair to mention identifying the acute clinical problems as well. And often people would walk into Maggie, not realising they have a problem, come in for general support, and I would notice, or one of the team would notice that there was something wrong, would pick it up in the conversation, and they could be referred back to the NCCC via the relevant oncologist or the on-call team. And often the result has been rapid and timely medical management. And during COVID, many of the WhatsApp group members posted new symptoms because we didn't really have any access to anything else easily at that point because of not being able to attend the hospital as previously. And I have regularly picked up clinical problems, and some of them have been medical emergencies during this time. So next slide, please. So now to the headlines and the beginning of all of this, well, the situation that we've been in for all these months. So at last, January the 31st, Brexit Day, and we all wondered what we were going to talk about after this. However, it came along on the same day. Here it is, killer flu, Brits in quarantine, and very quickly, who remembers Brexit? Next slide, please. So the story, so this should be the secondary breast cancer support group slide. I'm now going to tell the story of some of the women and who've been living with metastatic breast cancer during this very time. And I'm not detracting from anybody with any other type of cancer because they've all struggled, but it's just because of the WhatsApp group, things evolved that I didn't expect to happen. So through the timeline at the bottom, you can see the curve of the COVID cases, and the red arrow marks the date of each individual slide. And throughout this timeline from the WhatsApp group, many of the words are theirs. And on the 31st of January, the WhatsApp group had already been set up for several months. But as I said, was updates to peers, it was about families, about holidays, about birthdays, and I had no idea how big it would become. So this was a message that came through on the 31st of January. One of the ladies sent the message, 2 people tested positive for coronavirus in the UK, and there was some interest, but not many people were worried. And in February, the couple's night went ahead. There was beer and Prosecco just to relax everybody a little bit, obviously just a small amount of beer and a small amount of Prosecco, and it was very well attended. So at that point, anxiety amongst these patients wasn't apparent. Next slide. And in February again, the news, virus panic and fears grow across the country. More Britons tested positive. The NHS wouldn't be able to treat the weakest if the disease takes hold in the UK. And still, most of the group messages were about Shelley's wedding, one of the young ladies who was getting married the next day, and they had more interest in that. Next slide, please. And then with headlines like this and COVID creeping in, people did begin to worry. The NH isn't ready for the coronavirus crisis. Got quite scary. Next slide, please. In March, coronavirus arrived in Sunderland, said one of the ladies. Now I'm scared. And another lady decided she wasn't going to come to the support group. Her lungs are compromised, and the news about the virus has got her concerned, and she wasn't going to attend a friend's funeral, which normally people attended the lady's funerals. Next slide, please. In March, there was more concerns from individuals. The monthly support group went ahead, but with very reduced numbers. I cancelled the Living with Secondary Breast Cancer course because I thought this is now becoming a problem, and women with metastatic disease and on treatment are not going to be able to come along to something like that. And one of the patients sent a message to say, do you think there'll be any issues over the next few months with access and medications? She meant from the production side of things, and I said no, not as far as I was aware. But little did I know the scale of interrupted medicines on the horizon for people with cancer. And some people began to get sent home from work at high risk, and this highlighted the fact that they were different and potentially had more to be afraid of in relation to the virus, and so fear became more evident. Next slide. Supermarket chaos started, and the news from Italy was worsening. Looked like there was going to be rationing. People started to compare it a bit to the war, those who had been around. Or next slide. There was problems with shopping. People were starting self-isolation and they were too scared to go out. Some were quite freaked out, was one of the ladies' quotes, by the government announcements about 12 weeks of shielding, and didn't know how they were going to cope with that. Can't afford time off work, working from home for the next few weeks, but not 12. People just didn't realise how this was going to emerge. The quote from one of the ladies, schools, restaurants and gyms closed here, everyone home working, praying for an end to this. This is a lady who used to attend the support group and lives in Switzerland, and because she lives in Switzerland, at least she could contact people still via the WhatsApp. People were now getting scared about the treatment as well. They were fighting in the aisles for pasta, toilet rolls and hand sanitizers in shops. Delivery slots were hard to get, and there was no provisional for the vulnerable yet. Fear was definitely ramping up. Next slide. This is a case study on a young lady who is only 28, married with 3 children, and had secondary breast cancer. She got in touch in March at 10:06 at night via the WhatsApp, and it became apparent to me that WhatsApp groups are a bit like not for Christmas, they're forever, or unless you opt out of them. And the hours that people could contact anyone in that group became apparent that it was 24 hours. She had a fever, and I'd rung the alert number and was waiting for a call back from the nurse. She'd been started on antibiotics 2 days previously for an infection around her porticus, but in about 10 minutes later, she started to panic and said they won't have me because of the virus. She was told to take her medication that she'd been given by the GP and call back in 2 hours, and felt she was being forced to stay at home. I apologise for her language. Another half an hour, the ward definitely won't have me, she said. the nurse said she'd have to wait till 8 o'clock and ring again. By 7 o'clock, temperature was up to 39.5, and she said, this is unbelievable. Because I had access to the WhatsApp messages, of course I was concerned, so I contacted a consultant who arranged an immediate admission, and this lady ended up in hospital as an inpatient for 9 days with no visits from her husband or children. It was an infection around her porta and she had that removed, but she was extremely stressed and scared that access seemed to be less than it would have been pre-March. Next slide, please. Then we get lockdown news, events to be cancelled, Mother's Day cancelled. That young lady actually ended up in hospital over Mother's Day and got in touch via the WhatsApp with everyone, telling them that she wasn't able to see her children, that it was her third Mother's Day since diagnosis and possibly her last, and she couldn't cope with not being able to see them. Thankfully, I was able to let her come into Maggie's at that point and see her 3 children and her husband. So at least she had some kind of a Mother's Day. And then it looked like life was going to be put on hold for all of us. Britain shuts up shop. Next slide, please. We're now at the 18th of March and messages and calls were coming thick and fast, and I was becoming inundated and realised it had to be managed because it wasn't really, I couldn't continue with the sheer volume. One of the patients, or a couple of them, proposed a questions and answer WhatsApp group and keep the support group separately. And although that did happen, it had unintended consequences because, as well as answering the questions, I still needed to moderate the support group to a degree because some of the posts were, you know, not as appropriate as you would want. I don't mean in a difficult way. It's just some of the ladies put a lot into their messages and they needed to be managed because of the others. Next slide. Anxiety was rising again. Whether there was going to be face-to-face clinic appointments, whether they'd be changed to telephone calls, how would they get their bloods done and treatment if they're not going to be seen, and what about scans? Will they get treatment? Will it be stopped? And the anxiety was becoming really, really evident. Next slide. These were quotes from one of the ladies in the WhatsApp group. She was afraid if her treatment is stopped, is afraid to go to hospital if it isn't stopped, wants a scan, afraid to go for a scan, afraid to get on the scanner as she'll have to touch it, afraid she has to open a door, afraid to even use the toilet in the hospital. And this was not uncommon to hear from patients. So yes, they wanted to go, but they were scared to go. Next slide. And then Mother's Day, one of the ladies, we can't even walk our dogs now, although we can open a window, but we can't leave our house. Don't go outside your property, ask others to take rubbish out, getting pretty scared of this. And that's the first weekend of lockdown in Whitley Bay. That's my dog there, and not much else going on. And on Mother's Day, a nice sunny day like that, it would usually be absolutely packed with people on the seafront. So it was getting scary for all. Next slide. Shielding text started to arrive, identifying people as high risk, and they were being told to stay at home for 12 weeks. CT scan cancelled, so they don't know if my chemo is working. Does that mean my treatment will stop? I am young, I have an aggressive triple negative cancer, and it terrifies me just to be left for 12 weeks. Husbands and wives from these groups of women were starting to sleep in separate beds. They were so scared. And then, of course, the schools closed, and that made things even more difficult. Next slide. Historic address by the Prime Minister on the 24th of the 3rd, and the country is closed. And I think, well, I know from personal experience, when that happened, I had no idea, no perception of how long this would last for. And I honestly thought it would be a few weeks and then everything would be back to normal. Next slide. More terror amongst the women with metastatic breast cancer. They were being notified by their cancer teams of treatment stopping, that they won't get an intensive care bed or a ventilator or survive the virus if they get it. And I was present when some patients were told this in the clinic, because although it very quickly went to telephone clinics, some of them were still being seen, and the clinicians were following guidelines and what they'd been advised, and we were all very, very, very in the dark about what would happen. But the fact that these patients were being told they won't get an ITU bed was perceived by them as choosing between healthy people and themselves, and it became utter terror coupled with some level of anger. Maggie staff across all 26 centres were told to work from home using telephones and virtual platforms, and there was to be no face-to-face service at that point. We were told to take mobile phones, divert the phones to the mobiles, laptops, etc., and we would be advised what next. By the 26th, so 2 days later, I decided there was an in-centre role for us in Newcastle. I didn't at that point know what it was, but I didn't feel I could close. I'm a nurse, why would I close? And thankfully I got the support of our Chief Executive and Chief Operating Officer to keep the centre open. I felt the role would evolve and it would become apparent over time. And a young lady that some of you might have seen her story on Children in Need, Lindsay, who passed away in April, her situation later that week was a penny drop moment for me, and we began supporting visits in Maggie's for people close to the end of life and their immediate families. And we were the only centre, Maggie Centre, to remain open during lockdown for face-to-face support. And I can honestly say it's been the most worthwhile thing I've been involved in during my whole career, because people who are dying need to see their families, and that's kind of the role that we took on. Next slide, please. So this is the story of Lindsay, for anybody who didn't see the Children in Need story. And on the 23rd of March, at her request and with agreement from her oncologist, I attended clinic with her. She'd been told she couldn't take her husband and knew she was due to discuss treatment for brain metastases, and she wouldn't remember what was said. So I went with her, the treatment plan was agreed, and she was going to start some radiotherapy. Very sadly, on the 26th, she developed some symptoms and had to be admitted to NCC as an emergency because she had problems walking and talking. She was scanned and given the news that the brain metastases were rapidly progressing, and so she was an inpatient. Matthew and a little girl, Louisa, who's 6, had to leave her at the entrance to the cancer centre. Matthew had handed over to a couple of nurses and was devastated that they couldn't go in there. But of course, this was very early in lockdown and, you know, not felt to be safe. On the 27th of March, she shared on the WhatsApp group that she couldn't see a little girl and her husband. And Lindsay's oncologist got in touch with me and asked if I'd consider letting the family meet in Maggie's the following week. I arranged a visit for the next day, which was the Saturday, and Lindsay, Matthew and Louisa came in and spent several hours in the centre. They had a picnic. Louisa drew pictures of her mummy, daddy and herself. She danced for her mummy. We get some lovely cuddle quilts from some lovely ladies who make them for children who have a family member with cancer. And it's to encourage the child to cuddle underneath the quilt with the parent or the grandparent who's poorly, so that they're not expecting to do lots of running around, and it just encourages quiet time. And I gave Lindsay and Louisa the choice of a quilt. Louisa chose a lovely one that had a nice cuddle underneath. And then when it was time for Louisa and her daddy to go home and Lindsay to go back to the ward, Louisa wanted to give her mum the cuddle quilt to take with her. So of course they came out again and they chose another one for Lindsay, so they had one each. And it meant they could have virtual hugs. Most of the time the children take these away to use at home with their parents, but we knew Lindsay wouldn't be going home. So she took hers to the ward and Louisa took hers home with her. They met again on the Monday and had another lovely few hours. And very sadly, Lindsay died less than 2 weeks later. She had a tiny funeral. No celebration of a vital young mother was possible. And following this, Matthew and Louisa were locked down together for months. At the time, there was no face-to-face contact from family and friends, no childcare, no school. for Louisa to go to. Matthew was devastated, obviously, at the loss of his wife. He was homework and he was homeschooling. No distractions, nowhere to go to take your mind off what's been happening. And the father and daughter were at home alone with their grief. And I just think how tragic and heartbreaking that could happen to a young family. But it's what was happening during this period. Next slide, please. So more fear. The Prime Minister says things will get worse, but the British spirit will beat coronavirus. Next slide. Moving swiftly on. And then in April, there was Meltdown Saturday, or that's what I choose to call it. The WhatsApp group opened up as usual and started with general garden and social chat. And then by 3 o'clock, the mood had changed. And one of the girls sent a message, I just want to do a serious check-in with you girls because I've just had a bit of a bloody meltdown. She was one of the younger ladies, she's in her early 30s. And after that, it opened the floodgates and there was message after message coming through. One of the girls, I must admit, I'm struggling mentally. I'm in the mindset of I'm meant to be enjoying life before this cancer kills me and I can't even do that. Then I'm getting really angry with people moaning online about staying in. Why are they moaning? Got their whole life ahead of them after this and it will just be a memory. It's having a knock-on effect on everything. Is my treatment working? If it is, it's not like it's going to work for enough time. I hate self-pity, but everything is so negative. And message after message came through. And by 3:15, I actually got in touch with them and suggested an emergency Zoom group, which we'd actually started to do Zoom support groups at this point. So it was zoomed in at 4:30 with many of the ladies joining in. And because it was Saturday, I suggested if they wanted to, they joined with a glass of wine. Some of them did. One of them had already had a few. The Zoom group went well. So we were able to share their anxiety and just talk through things. And then by 5 to 7, the normal chat had resumed again with talk of supermarket delivery slots. Next slide, please. Another message about a lady who had to ring 111. I know 111 was stopped. People were waiting on the line for long periods. Then they were being told someone would ring them back. I heard reports of people being rung back after several hours to be told we can't advise yet and we'll ring you back as soon as possible. Then they were advised to stay at home as safer there and people were in a complete panic about this. The telephone clinics and cancer diagnosis being relayed over the phone was becoming more common, telling people to stop treatment, news of disease progression being told over the phone. People weren't being physically assessed the way they used to be, and many patients were saying they couldn't communicate properly over the phone or take in what they were being told. One of the ladies who came into Maggie's to see us in a very distressed state one day had been informed of her lung cancer diagnosis over the phone when she had no one with her. And immediately after the call, a doorbell rang. There was a delivery driver there, and she burst into tears and told the poor man delivering a parcel while he was standing at the door that she had lung cancer. Well, she was absolutely hysterical. And there was a time when giving bad news over the phone was a big no. However, the pandemic and coronavirus changed all of this. And important consultations have continued over the phone when the need has been there. But even sometimes consultations have continued over the phone when we can go to garden centres, gyms, bars and restaurants. So whilst I do agree there is a place for telephone clinics, I do think people with metastatic disease, maybe it's not always right for them. Next slide, please. Naturally, Boris got an intensive care bed, and the ladies with secondary breast cancer had been told they wouldn't, and most of them over the phone. Next slide. People that were more still terrified about getting COVID and not standing the chance of getting a ventilator. One lady said it's getting crazy and taking over my brain. My son coughed twice through the night and I sat in his room for 2 hours at 2:30 a.m. taking his temperature every 20 minutes. You can see on the bottom, the COVID line, the cases rising And I could really, really feel now through the WhatsApp messages and phone calls to the centre and people making appointments that the terror was becoming magnified along with the rise in the COVID cases, understandably. Next slide, please. There was no relief for parents with cancer because there was no grandparents or family support. Parents were under immense pressure during lockdown, children at home. The adults had no privacy for the sadness and grief associated with having cancer, no privacy to talk to each other if they were at home with a husband or wife, no privacy to cry. They were trying not to let their guard down as they were keeping up an act to protect their children. Children were watching their parents deteriorate physically and mentally. We're missing school, friends, grandparents, normality, and I felt at this point, and still do, that many problems are being and have been stored up for the future. And then there was the worry about careers, furlough, job losses and financial problems for us all. However, for those with cancer, it was again huge, and the impact on families, particularly the young ones, has been and is off the scale. Everything that kept me sane and positive has been ripped away, and I don't know if it will ever go back to normal. The lady who made this quote actually died during lockdown, very sadly, but she tried desperately to hang on to some normality. Next slide, please. And then by the middle of April, the Zoom group that was set up had become, I set up a Zoom group for sort of questions and answers and a support group, and it was weekly instead of the monthly support group. And that seemed to help the ladies, and there was quite a lot would join this. But it looked like the Northeast was appearing to be over the COVID peak. So I asked Dr. Mark Verrill, because he was easy to contact, if he would join the Zoom group on this occasion for a general questions and answers about shielding. And he was able to give the reassurance from the medic's point of view that the Northeast seemed to be over the worst at that point, that the ITU capacity was adequate, and the previous grim forecasts were overly pessimistic. So women were absolutely relieved and overjoyed to hear that there was not going to be rationing of ventilators, and that if they needed a ventilator, they would get one. And the relief and positivity expressed by the group members on that occasion was tangible. And it just really helped to have a medic from the front line of cancer care come and just talk about the fact that if they got it, they were going to have as good a chance as anybody else of being supported and in intensive care. Next slide, please. So the letters and texts about shielding started to cause more confusion. The teams in the cancer centre and us in Maggie's were completely in the dark about who was receiving what communication and when, and it seemed to be random. There was one lady I knew who had breast cancer 10 years ago received a text to shield, and the fact that shielding was now possibly going to be extended began to get people, get them down. This is so unfair. We should be out with family making memories. Just seen in a newsfeed that vulnerable people could be kept locked up for another 12 to 18 months. Not a bloody chance that I'll not see my grandchildren for up to 2 years. I think by then all of us were tired of restrictions, and the people with cancer who were in a much more difficult situation were even more tired, but still very scared. Next slide, please. I noticed at this point more people with metastatic breast cancer were making one-to-one appointments with me and Maggie's to talk about physical and emotional concerns, relationship problems, etc. We were desperate for face-to-face contact and reassurance. And of course, we were doing this very safely, you know, keeping social distance. Masks weren't mandatory at the time, so we were giving the patients the option. They had concerns about work, not being able to go because they're shielding or because their employees don't want to take a risk, and very, very hugely concerned about redundancy. And it was particularly devastating for the young women in the group, the ones who had young families, because they were of the age where they were often working, or at least their partner was working. There was also rapidly growing concern about interrupted treatment and cancelled surgery, and the relationship problems for a couple who were newlyweds became appearing and the cracks became visible as well. And these two couples separated quite close to this point. Next slide, please. This impact on children was becoming more apparent from this group of patients, and the fact that they were becoming anxious themselves and the children's mental health was being questioned. This poor lady said if she could get out into the world and take a short walk with her daughter, she felt it would help. They wouldn't sit on any benches. She felt like she was breaking the law even thinking about a walk. Next slide, please. This is a case study of a lady who spoke to me over the phone and was absolutely hysterical. She's a 42-year-old, 2 young children, and had a face-to-face 2-week wait appointment when she had a core biopsy for a breast lesion seen on ultrasound. In April, she had a telephone appointment with a consultant and was diagnosed with 2 cancers, and she was recommended over the phone to start tamoxifen, a prescription to be sent out, and she'd have a telephone follow-up with the breast care nurse in 3 months' time. She contacted Maggie in May as she was so distressed about a delayed surgery, and I managed to get in touch with a surgeon, and he actually was very happy to help this lady. An operation took place a few days before, but she'd not seen anyone involved from the team since the biopsy, and was really, really stressed about only having a telephone appointment, and couldn't stand the wait, the fear, the stress. She wasn't coping. She was crying every day, and her children were witnessing this extreme distress. Thankfully, the team did react very quickly when they heard about her distress, and that lady did get the surgery sooner than she would have. And, still at this point, the teams in the NHS, the healthcare professionals were being guided because we didn't know how this was all going to pan out still at that point. Next slide, please. And then news from the Lancet that there's no evidence that people on cancer treatment are more at risk of dying from coronavirus than anyone else. So that was great news for the patients, and such a relief. Next slide. This is an unusual story to happen to me in my role, and it's to do with domestic abuse. And this is a lady who has secondary breast cancer as well, married with 2 adult children, and a 13-year-old grandson lives with her. She was on treatment for secondary breast cancer and had been in lockdown with her husband and grandson. And she rang me one evening and said her husband had become abusive and actually tried to kill her. And her and her grandson had managed to get him off. They'd had previous relationship problems, but had come to a head during lockdown. During the call, I ascertained that she was in a safe place for overnight, but she couldn't stay where she was for another night as she thought he would find her. She'd managed to get out of her house while her husband was using the bathroom. And while I was talking to her on the phone, I asked if I could, contact the police, but she was not wanting that to happen. So knowing she was somewhere safe, I arranged for her to come to Maggie's first thing. She then agreed that the police were alerted, and with her consent and after a very long day of many phone calls to various agencies, I managed to get a place in a women's refuge confirmed for her at 5 o'clock. I pulled together a goodie bag from some raffle prizes and sent her provisions because she didn't have anything with her, and off she went. But for me, as a specialist nurse for many years, yes, I've heard stories of domestic abuse, but to actually be in that situation, to be the first person to be involved and have to get her into Maggie's as a safe place the next day has never happened to me before. And again, lockdown had a big effect on this couple. Quite shocking, really, to think. And, this lady will not be the only one. As we all know, there's going to be all kinds of things, the fallout from this pandemic. Next slide, please. So more of the young women were requesting meetups in the centre, and these were the under 40s. One of the days I arranged for 5 of them to come into the centre in the middle of June because they couldn't stand the isolation anymore, kept them well separated. They had a glass of Prosecco and pizza and really, really enjoyed it. And I put them in the big room. The laughter was wonderful to hear. One of the under 40s was a lady who'd been travelling from Scotland every week. She was in a clinical trial in the Freeman and was in a hotel with her husband from Monday to Friday. couldn't see her 2-year-old son, only at weekends, was very isolated. They were sitting in a hotel room when they weren't into hospital, and they actually came into Maggie's by chance. And once they realised they were there, the husband would stay there through the day while the lady was having a treatment and work on his laptop. But she also introduced her to some of the younger women because she hadn't met anybody as young as her with secondary breast cancer. They call themselves the Little Miss Maggie's WhatsApp group. And so that became the third group, as they identified very different issues that were relevant to them. But they had a slice of pizza and a slice of normality, really. But this group has evolved rapidly and now has the most messages by far, and with the biggest content and difficulties demonstrated. But you would expect that, I'm sure, with the age and everything that's happening to them, the young people. Next slide, please. This is a lady who was diagnosed with breast cancer, then secondary breast cancer, and she worked as a special needs teacher. She only got married in May 2019, absolutely loved her job. Husband was a radio DJ, and as time went on during lockdown, she had her treatment interrupted. She felt less well. She had extreme anxiety about cancer progression, but more about getting COVID. So COVID was much more of a fear than her cancer. She did show some disease progression over the few weeks following her treatment being interrupted. And the question she now asks is, did her disease go to liver because she was off treatment for 4 weeks, or would it have happened anyway? Now, the biggest likelihood is that that would have happened anyway. The problem for her is it doesn't matter how many times we kind of try to explain that 4 weeks isn't a big amount of time in a treatment pathway, and for treatment to be interrupted. It's difficult for her to get her head around that and believe that. Her husband was furloughed during lockdown. That compounded problems for them. She was unable to work with the children that she worked with because of shielding. She came into Maggie's to see the psychologist and had regular one-to-ones with her, and was part of the support group via Zoom, and also came in to see other younger women. She feels they should have been having a good time during this pandemic and gathering precious memories as a couple when she's no longer around, and that in the first year of her marriage, which was from 2019 in May when she got married, they'd had holidays and other trips away planned, and she actually feels that she's been cheated out of treatment and out of things that they would have done, which is very sad. Next slide, please. This is another case study of a gentleman this is just to explain about bereavement during lockdown, and I'm sure you'll have come across this. This is just one man's story, and his wife he was on a cruise in February 2020. She was swimming with dolphins, and became unwell when they were away, but coped until the last 3 days. COVID fear had already started, and they were very uncertain whether they'd be able to leave the ship and fly home. However, thankfully they managed to do this, and they arrived back in the UK on the 7th of March. She had a face-to-face appointment with her oncologist shortly after that, and was diagnosed with liver metastases, which were biopsied. She was consented for chemotherapy, but very sadly the disease progressed rapidly and the plans had to be abandoned. And I actually told this gentleman that his wife was close to the end of life over the phone because she was too ill to attend any of her appointments. And very sadly, she died in the first week of lockdown. The night she died, the district nurses came to his house at 8 o'clock to give analgesia and sedation, and they told him to get some sleep. We should need him the next day. Very sadly, he fell asleep, and when he woke up, he went upstairs to check on her, and she had already passed away. He was obviously in a state and felt he needed confirmation, rang the district nurses but couldn't get through, so rang 999. A policeman came and confirmed that Jen had passed away. Then the district nurses came and left Frank with a list of things he needed to do. He had no family with him because of the situation. He also hadn't realised how close to the end of life Jen actually was, and he has terrible guilt that he didn't recognise this. There was a funeral with very small numbers, and his nephew came from London to move in with his mum because he was going to be able to work from home. And after the funeral, the very small family, so Frank and his 2 children who are adults, and Frank's nephew and sister-in-law and brother-in-law went back to Frank's garden just to raise a glass to Jen. And apparently somebody reported the nephew being in the garden. He was arrested and kept in the cellar overnight, which for the family was devastating. And, you know, again, very extreme situation. 4 weeks later, Frank went to the cemetery as he was having a really bad day, and it would have been his and Jen's wedding anniversary. And unfortunately, the cemetery was closed due to coronavirus, so we couldn't even get in. Next slide, please. So I'm moving on now to the support that evolved during COVID in Maggie's. So March to June, the drop-in support had stopped. There was booked visits from NCC for the inpatients close to the end of life to see their loved ones like Lindsay, and the teams in the hospital were really, really supportive, and we booked the appointments, we gave people an area for themselves or a room. It was only a very close family, and was very important to lots of people. There was booked face-to-face appointments for individuals from the same household to discuss psychological issues, treatment-related side effects, new symptoms, potential disease progression was picked up, and acute problems like I mentioned earlier, and they were still able to get benefits advice. There was a Zoom support group for the secondary ladies and Zoom support groups for many of the other people with different types of cancer. Telephone, FaceTime support from all staff, and of course we've heard about the WhatsApp group. And then, as I mentioned, there were small meetups of women with social distancing as they became increasingly desperate. Next slide, please. From June to now, the face-to-face drop-in and booked appointments have continued. The metastatic support group for the ladies now is face-to-face, and there's also a Zoom one. But because of having to restrict the numbers, we have 4 groups a month, so one every Wednesday, and each person who used to attend the group is allocated their own support group bubble. So the numbers are much reduced. One of them is the Young Women's Group, and they're a small group who come once a month, and then the others are split up into their own individual support group bubble. The Living with Secondary Breast Cancer course is going to resume, but with much reduced numbers, and ward patients and the families are still coming over, and it can just be a space to be quietly sitting. The WhatsApp groups ×3 continue, but I do manage them very carefully, and the ladies know I'm not going to be checking them out of hours willy-nilly unless there's something really specific that comes through the WhatsApp questions and answer group. Next slide, please. We're coming close to the end of the presentation, so I'm sure people are getting ready to wind down a bit from this, but this lady didn't have breast cancer, she had colorectal cancer, and she's age 44 with two children aged 12 and 13. She'd had major surgery for colorectal cancer in 2019, and it was followed by chemotherapy. In January 2020, she developed new symptoms, which led to a diagnosis of liver, lung, and peritoneal metastases in March 2020. She was seen by a consultant, and at that time, when we were just going into lockdown, advised to wait 3 months for chemotherapy due to COVID. She was given a two-year life expectancy with chemotherapy if she had a good response, but of course, at that point, she was unable to have the treatment. And she was booked in June to have a telephone clinic with the CNS following a CT scan. This showed small volume disease progression in liver, but the other sites were stable. It was suggested she could wait another 3 months, but she actually insisted on chemotherapy. She'd been locked down at home with her children since diagnosis, and her husband, of course, since diagnosis of metastatic disease. And over the time, her mental health had got much worse. Her husband rang and spoke to me one day as he had huge concerns about her. And he brought her in. She was extremely emotional and agitated and crying, angry, apparently paralysed by fear of the cancer and it not being treated, and she couldn't get the 2-year mark out of her head. She can picture the date on her calendar when she's expecting to die, and of course, like everyone, there was nowhere to go to distract herself and take her mind off things. She didn't want her children to see her like this, but she was unable to hold herself together. She said the children are always there because they're not at school, There's no escape from the cancer for anyone, and she feels she should be creating special and good memories for the kids when she's gone, but there's nowhere to take them. One night recently, when the rest of the family were asleep, she considered going out and jumping off a cliff to end the uncontrollable mental anguish and take away the burden she feels she's being to those she loves the most. Because we didn't and don't have a colorectal support group or a young women's group at the minute, although we used to have a young women's support group for women with any cancer, I suggested she join the secondary breast cancer group, as she's got similar issues and there was not much else available at that point. And once you've had a primary diagnosis and it's become, does it make much difference for support issues if the cancer started in the breast or in the colon? And she joined the young women's support group quite happily and gets on very well with everyone. Next slide, please. So the themes that have come through this presentation: treatment interruptions, and we are seeing people coming in with progressive disease. And like I said, it may have happened anyway, but it's difficult for people to get their head around that fact. People are swamped with all manner of emotions, and we won't only have their physical symptoms to treat. The consequences of progressive disease during lockdown is, of course, unprecedented, but has got devastating implications. People are struggling to believe that it would have happened. And telephone clinics, people are being notified by telephone about their treatment stopping, getting results and bad news over the phone. But hopefully now that we're further down the line, this will be much reduced. During lockdown, people with incurable cancer weren't able to be physically assessed the way they could be, and the schools were closed. Parents with cancer were coping with children at home for months. There was no escape, no family support possible. The parents were under immense pressure. Extended family is really important when people have got cancer. Emerging relationship problems became very apparent to me during all the WhatsApp messages from the couples. The ward visits to be given bad news with no family present is cruel and traumatizing, and it's happened to many people, and I'm sure you've all heard or come across them. There's been people dying alone when the patient was too ill to know that anyone was there and maybe no longer able to recognise their family. One of the nurses on the ward in the cancer centre I spoke to said at one point there was reports of family members who were too afraid to come to the hospital for the final hours of a loved one because of COVID. Hopefully this wasn't many. And then funerals, families are devastated not to have been able to give their loved ones a good send-off, particularly the young people. And there's lots of grief and guilt around the funerals because they can be cathartic. Then we've got furlough, job losses, extreme financial hardship and worry for the future. I've spoken to more people with cancer during these last 10 months who are having suicidal thoughts than I have in the previous decades I've been a qualified nurse and in the previous 7 years that I've worked at Maggie's. And the suicidal thoughts I've heard were all to do with living with cancer during lockdown. Then the domestic abuse, there will have been more child abuse across the board anyway, but for people with cancer, domestic abuse, child abuse, if you're in the last, missing relatives, family, no hugs, no physical contact, seeing family through a window or from a distance in the garden. One of the ladies who's part of the support groups got metastatic breast cancer, and Emma's 90. She hasn't been able to visit her, and she doesn't know if she'll ever see her again before either she dies or her mum dies. And if you're in the last few months of your life and you can't spend time with people from your family, what's right about that? The disruption to people has been unbelievable. Next slide, please. And then in September, we got the news once again, people were going to have to work from home, those who could. Home working U-turn, and the pubs were going to be curfewed, more must wear masks, and it looked like we were heading for more problems. Next slide, please. One of the ladies who was actually in the face-to-face support group decided she would not be put under house arrest again, life for living, and she wasn't going to sit dying in a back garden again with tears running down her face. And this lady had actually gone back to work, and she said, we've been told that office workers are to work from home. I'm back at work and I'm staying there. What's left of my life is mine. And I noticed that although the patients were still extremely anxious, the anxiety was less than it had been during the original lockdown. The COVID cases were rising along with more media hype. But it felt very different for everyone, and also for the people with cancer during the second partial lockdown. Next slide, please. And then we've got the tiers. So yes, the tiers, but the tiers 1, 2, and 3. And after 8 months of sacrifice and millions of jobs hanging by a thread, there's still not really a proper plan according to the media. Next slide, please. There we are, obviously in tier 3. However, still not as strict as the original lockdown, because we can still actually go to some shops. And I noticed B&Q was open, and now we've got Newcastle open again, the shops there. Anxieties are once again there, but and coupled with the lockdown, but reduced. I'm finding now people are more back to the anxieties about the cancer, not COVID. Next slide, please. And then short, sharp lockdown on the cards. And we know as we approach the winter months that we're going to have to be particularly careful. So this was October the 14th. Moving on, next slide. Then we get to the news of the vaccine. Hooray. And I had no idea I was going to be doing this talk on the day of the vaccine, but it looked like it was heading our way. Shot in the arm was going to be COVID, vaccine milestone coming, normal life by next spring, music to everybody's ears. Next slide, please. Vaccinations next week as the Prime Minister's caught in Brexit row. So here it is, the long-awaited vaccine, and things must be beginning to improve as the Prime Minister has once again got Brexit on his radar. Next slide. So the evolving needs of those affected by cancer, incurable cancer. We know during 2020 we've all had to adapt to new ways of living and working, and some of the learning will help us with efficiency. Patients and their families' support needs are immense, and they've been magnified by the lockdown coupled with cancer. They need to be seen face to face and really cannot be fully assessed over the phone. As I said previously, it's important to see people. Sometimes just how they walk into a clinic can be enough to tell us something's not right. We now know chemotherapy isn't a death sentence for those who get COVID. Life-extending cancer treatment mustn't stop, and mental health service provision is an essential part of the recovery from the damage that's been done by coronavirus to people living with cancer, and it's going to continue. That we need support to these people for a long time. Healthcare professionals, we need to be there. Cancer hasn't stopped because of coronavirus, and health services can't either. Next slide, please. Because cancer doesn't stop because of coronavirus. However, the fantastic and long-awaited news today is the first person to be given the vaccine outside of a clinical trial had it at 6:31 a.m. this morning. Next slide. So how wonderful. So we can't end this talk without celebrating today's news, and how absolutely amazing that something that would usually take 10 years has taken 10 months. And as Sue and Joe said at the beginning, the NHS have come up trumps with this, and thanks to Pfizer and everybody and everything that's been involved in making this happen. It's been an extremely tough year for all of us, particularly for our patients and their families, and we're certainly not out of the woods by a long way, and we need to continue with great care. But let's hope for a much needed return to some kind of normality and a better 2021 for us all, and to take forward the learning that we have had this year, and maybe find, streamlined services, and we will find more effective ways of working, continue with the support that we give to these people. Thank you all very much.
Thank you so much, Karen, and thank you for finishing on such a positive note. But can I just say, this is probably one of the most powerful presentations I've ever sat through, to sit and listen to the experiences and the stories of the women that you were involved in. And I think for me it's the way that you've told the stories through the timeline, and the insight that you've had through the WhatsApp groups and the Zoom. And for me it's been heart-wrenching, and I'm sure that the rest of the audience feels exactly the same. I feel so emotional about what we've listened to today, and I've scrolled down lots scroll down lots of notes, but you know, the line that's going to stick with me and what will stay with me is one that you said towards the end about the lady, what's left of my life is my own. And I think that's a very emotional quote, because I think that summarises all of the stories that you've told, isn't it? Is that that time is so precious for all of these women that you've talked about, and sadly was precious for some of those women. And I think you told those stories absolutely beautifully. Thank you so much. There is one particular question that I know we're just over time, but it struck me as well, and Annie has asked this question. What I was thinking about all the way through, and obviously similarly, Annie, is how did you and your team cope throughout this? Because you were absorbing and supporting, and that was very, very intense for you and the rest of the team. I can't imagine how dealing with lockdown yourself on a personal level for yourself and your family.
Yeah, I mean, I have to say, I've been around a long time. I've been qualified for a long time, and I count myself as being lucky enough to be very resilient. And, personal problems and things, I'm usually reasonably able to cope. And I've been a qualified nurse for 40 years this year. And the last few months have been the most challenging and intense time in my career. I've never felt so stressed in all of my career. And also, as we got further into lockdown and I was hearing these stories, I began to feel angry. And, I'm not angry at work. Yeah, I get a bit fed up sometimes, like we all do, or a bit irritated. But I've never been angry. And I found I was bringing it home. And, some of you know I'm married to an oncologist. So I was, well, why are you stopping their treatment? What right have you got to stop their treatment? And it became a little bit personal. And of course, I got over myself. And the team, there was only 3 of us working in the centre during the lockdown, because others, for various reasons, either worked from home because they had shielding issues, or, didn't feel safe to be in, or didn't actually need to be in. So the 3 of us had a lot to deal with. And I think we supported each other. But for me, what gets me through is eventually being able to, call on my sense of humour. But I have been extremely affected. And the WhatsApp group was a huge part of that. I had no idea what that would become. And when I started to scroll back through all of the messages to try and pull a presentation together, that's when I realised why I had got so affected, because of the volume of these messages. That's only the tip of the iceberg I've shown. So it's a real, it's almost a book, the WhatsApp messages. And I did think, should I do something with them? But yeah, it's been difficult. And I know it's been tough for everybody for various reasons. But, just, trying to get support actually from, the small amount of family I've been able to be with, the people who live in the house. But we've just kind of pulled together. And when you see what the people are going through, it makes it all worthwhile. And in all of the years I've been qualified, although this has been the most stressful and difficult, it's also been the most worthwhile. And I have learned so much to take into next year.
And I was just going to say that, I hope you take some time to reflect on the difference that you have made to I'm sure, to all of these women in respect of the support that you've given.
Oh, thank you.
Oh, you're welcome, and thank you. Karen, can I just thank you again for a most amazing presentation. I've listened to a lot of patient experience, patient story presentations, and always found them powerful, but never as much as this one.